Hello friends, welcome once again to my channel Managing Diabetics. It's nice to see you guys responding to my videos. Today I'm gonna be please permit me when I'm looking left and right. I'm trying to go through my write-ups in order to communicate effectively on what I'm going to be discussing today. So if I'm not looking directly to the camera, I'm trying to catch up where I stopped, pick up my points in order to narrate it accordingly, that you understand what I'm trying to discuss or message I'm trying to pass across. So my today's topic is diabetics and high blood pressure. In my previous video, I've done diabetics and cholesterol to link both of them and the complication that is going to come with diabetics and cholesterol. And I've said numerous times that diabetics, cholesterols, and high blood pressure are all interwoven. Hardly you see anybody that is diabetics that doesn't have an issue of cholesterol levels or high blood pressure. And that is why anytime you are on A1C test model in managing strategies to treat your diabetics, we tend to monitor your cholesterol levels, your high blood pressure, and your diabetics, your sugar level. These are very important. They're all interwoven and they're all potent if not handled properly or managed properly. Okay, so today's topic is diabetics and high blood pressure. And you might be wondering how comes about what has to do with the high blood pressure and diabetics. Yes, there are linkage to one another. That once you are diabetics, you have to monitor your high blood pressure, you have to monitor your cholesterol levels to make sure that everything is normal. Now, high blood pressure is twice likely to strike a person with diabetes than a person without diabetics. I want you guys to understand this very well. High blood pressure is twice likely to strike a person with diabetes than a person without diabetics. Alright? If left untreated, high blood pressure can lead to heart disease and stroke. These are all linkage of high blood pressure, cholesterol, and diabetics. You have to make, as you're managing your diabetics, you're managing your cholesterol, you're managing your high blood pressure, because they're all interwoven. You might be lucky, you are diabetic, you don't have a cholesterol issue, or you don't have a high blood pressure issue. You might have a high blood pressure issue or cholesterol, and they escape diabetics. But it is important that when managing your diabetics, your doctor will look at your cholesterol levels and your high blood pressure to make sure that everything is normal. So a person with diabetes is likely to be struck twice than a person without diabetics if left untreated. And if left untreated, it's going to cause you to have heart disease and stroke. Okay? In fact, a person with diabetes and high blood pressure is 4 times as likely to develop heart disease than someone who does not have either of the conditions. So if you have high blood pressure, if you have diabetes and high blood pressure, you are now 4 times likely to develop heart disease that leads you to cholesterol. You see? When I started, I say if you have a high blood pressure, just look at what I'm trying to say. Let me go back again and replay. If you have a high blood pressure, you are twice likely to strike a person with diabetics than a person without diabetics. So for instance, now if you went to a doctor, see your physician, they say you have a high blood pressure, and maybe you don't even have a diabetics, they say you have high blood pressure. Now you are 2 times likely to be struck by diabetics than a person without diabetics. You see, you have a high blood pressure, you are 2 times likely to be struck by diabetics. Now, let's go to the second model. If you have diabetics already, and now you have high blood pressure, 2 things at the same time, you are 4 times likely to develop heart disease than someone that does not have any of those conditions. And what does the heart disease have to do with your cholesterol? So you see how the linkage is. Once you have a diabetes, your doctor has to put an eye on your high blood pressure and cholesterol, because now your likelihood of getting all these conditions have expanded than somebody without any of it. So first of all, if you have high blood pressure, you are 2 times likely to be struck by diabetics. So you walk into a doctor's office now, and your doctor tell you that, oh, you know what, you have a high blood pressure, without even you having a diabetics or cholesterol. Now let's start with high blood pressure, so you understand what I'm trying to say correctly. So doctor say, after checking you out, they say you have a high blood pressure. So he's going to start treating you for high blood pressure now, or letting you know how to live with it. Now once you are being diagnosed with high blood pressure, what happened? You are now have 2 times likely to be struck with diabetics. So doctor now will be watching at your sugar level to see, are you pre-diabetics? And if you are not, doctor will start telling you to reduce your sugar intake. He's going to start warning you now, reduce your sugar. Maybe he see the trend, because from his practice, he knows you are likely to be struck with diabetes because already you have a high blood pressure. So your doctor will now tell you, now advise you to contain your sugar consumptions or watch whatever you are eating, because you are now 2 times likely to be struck by diabetics. Now you go in again, second time again, you say, oh doctor, I'm feeling something like a urinating all the time, frequent urination, I'm having a blood vision, my body is feeling me somehow. Then a lab test is carried out, bam, the result comes out, you have a diabetics. You see, from high blood pressure, the previous visit, you have now 2 times to be struck with diabetes. Then after 1 month or 2 months again, you go back to your family doctor again with the symptoms you've been exhibiting, and they say you have diabetics. So now you have high blood pressure, you have high diabetics. One thing is remaining, cholesterol. Your doctor will say, okay, now that you have both conditions, high blood pressure and diabetics, you are now 4 times likely to be struck or develop heart disease. And what is that heart disease? Your cholesterol. See it? How diabetics, cholesterol, high blood pressure, they are all interwoven. So now you went to the doctor, now they say you have diabetics. Before was high blood pressure. After 2 months, you went back, they carry another test, they say you have diabetics. Now your percentage of developing heart disease have increased 4 times, from 2 times to now 4 times of you developing heart disease, which is cholesterol. So if you don't check your cholesterol levels, or you don't try to make sure you reduce your salt intakes and other things, then you are 4 times likely to develop heart disease, which is that cholesterol that I'm talking about, than someone that does not have either of those conditions. About 2/3 of adults with diabetes have blood pressure greater than 130/180 mmHg, or use prescription medication for hypertension. Remember, another word for high blood pressure is hypertension. So 2/3 of people living with diabetics have high blood pressure greater than 130/80 mmHg, or use prescriptions. So this is why I said diabetics, high blood pressure, cholesterol are all interwoven. So it is necessary that if you have a family doctor treating you for diabetics, he will now try to, because your exposures of getting the other conditions have now increased. Okay? Now, let's define what high blood pressure is all about. I'm going to define what high blood pressure is all about, so that give you, in that context, you understand what I'm talking about. Blood pressure or high blood pressure is the force of blood pushing against the arteries wall. In your arteries, it's a force of the blood pushing against the arteries walls. Now, each time the heart beats, each time your heart beats, it is pumping blood into the arteries. So, high blood pressure is that force of blood pushing against the walls of the artery. Now, each time the heart beats, it is pumping blood into those arteries. And when it is pumping blood into those arteries, it's pushing against the arteries of the wall, resulting in the highest blood pressure when the heart contracts and is pumping the blood. Okay? High blood pressure or hypertension directly increases the risk of coronary heart disease, which is the heart attack, and stroke, brain attack. With high blood pressure, the arteries may have an increased resistance against the flow of blood, causing the heart to pump harder to circulate the blood. I don't know if you understand my explanation. Blood pressure is the force of the blood pushing against the wall. And how does it push against the wall? Each time your heart beats, it is pumping blood into those arteries. And when it is pumping blood into arteries, it's pumping against the wall, resulting in the highest blood pressure when the heart contracts. Because when the heart contracts, it is pumping blood. So high blood pressure or hypertension directly increases the risk of coronary heart disease, which is the heart attack, or the stroke, which is the brain attack. With high blood pressure, the arteries may have an increased resistance against the flow of blood, causing the heart to pump harder to circulate the blood. So when you have high blood pressure, your arteries now have an increased resistance against the flow of blood, because now your heart is now working harder than it should be. The rate your heart is working is now harder because your arteries are experiencing resistance. In order to pump the blood so that it's circulated at the rest part of your organs. That is high blood pressure. Okay? Now, two numbers are used to measure high blood pressure. The number one on top are the systolic pressure, refers to the pressure inside the artery when the heart contracts and is pumping the blood through the body. We use the systolic pressure, refers to the pressure inside the arteries. Remember, the pumping of the blood is against the wall. Okay? Anytime your heart contracts, it's pumping the blood. So anytime your heart is beating, it's pumping the blood. So use systolic pressure, refers to the pressure inside the artery. So it measures the pressure inside the artery when the heart contracts and is pumping the blood through the body. That's one. The number on the bottom, okay, the number of the bottom, we call diastolic pressure, refers to the pressure inside the artery when the heart is at rest and is filling the blood. One is systolic pressure. It measures the pressure inside the artery when the heart contracts, when the heart is pumping the blood. It measures that. Then the other one, the diastolic pressure, measures the pressure inside the artery when the heart is at rest and is at rest and is filling in with the blood. Now the heart is resting and is filling in with the blood. Both systolic and diastolic pressure are recorded as millimeters of mercury. According to the scientists, the Blood Institute of National Institute of Health, high blood pressure for the adult is defined as. So now your high blood pressure is defined as 140 millimeter of mercury Hg or greater systolic pressure. High blood pressure for adult is defined as 140 mm, that is millimeter of mercury Hg or greater systolic pressure, and 90 millimeter mercury of Hg or greater diastolic pressure. Okay? So This is high blood pressure for adult, the range. Okay. Now, for pre-hypertension, the guidelines, the measurement for pre-hypertension before you develop high blood pressure or pre-hypertension are 120 millimeter of milligram Hg to 139 millimeter of mercury Hg systolic pressure. Systolic pressure is when the heart is contracting, pumping the blood into the arteries. The diastolic pressure is when the heart is at rest and is filling in the blood. Okay, so it measures when the heart is pumping, working, and when the heart is at rest. That's how you measure your high blood pressures. So the pre-hypertension's measurements are 120 millimeter mercury Hg to 139 millimeter mercury Hg systolic pressure. That is when the heart is pumping the blood, contracting, pumping the blood into the arteries. Then when the heart is at rest, it's supposed to be 80 millimeter mercury Hg to 89 millimeter mercury diastolic. When the heart is at rest, filling the blood into the arteries. So that is why it is important you understand the contents of your high blood pressure, diabetics, and cholesterol. All these are interwoven. You wouldn't like to have those three conditions. If you are lucky and your first visit to your doctor says you have high blood pressure, no diabetics yet, no cholesterol, that is when you start working hard to make sure you mitigate developing diabetics to cholesterol. Because once you have high blood pressure, you are not twice to be struck with diabetics. And when you have both conditions, high blood pressure and diabetes, you are 4 times likely to be struck with heart disease, which is the cholesterol. You wouldn't like to be in those three. You wouldn't like to have those three conditions. Okay, so to try as much as you can. If your first visit says you have high blood pressure, then you don't have the condition of diabetics or cholesterol. That is when you start working hard to make sure it does not go lead you to being a diabetic. You start watching what you eat, controlling your sugar intake, eating in moderation, changing your diet, getting into physical activities. It is very important so that instead of that trend to progress, you return it back. Okay. Now, what are the symptoms of high blood pressure? What are the symptoms of high blood pressure? High blood pressure differs from individual to individuals, but there are 3 most important symptoms of high blood pressure that I'm going to give you. Because people with high blood pressure do not have noticeable symptoms. That's one thing with high blood pressure. You might not notice any symptom. If the blood pressure is greatly elevated, a person may experience the following. However, each individual may experience symptoms differently. That's what I said in the beginning. It depends on an individual. Your symptoms might differ from individual to individual. But there are 3 most important symptoms to know when you have a high blood pressure. 1, headache. If your headache lasts more than 2 days, any medication you are taking, I say one thing I'm going to advise about self-medication. It is important, yes, you medicate yourself. There are limits you can self-medicate. One thing with in Africa is that we are too much dependent on self-medications. We like to self-medicate ourselves to the point of death. And that is wrong. There are some death that is avoidable and there are death that is not avoidable. But when you self-medicate to the point that you medicate and medicate till you die, then you have yourself to blame. Now, symptoms is a message. When you start having symptoms in your body, don't ignore it. Never ignore symptoms. When you have symptoms in your body and you self-medicate for 2 days, 2 days to 5 days, and that symptom still persists or goes and come back, that's when you have to stop self-medicating to see a doctor. That means that self-medication is more than self-medication. You might self-medicate, it disappears, and later come back and continue. Do not continue self-medicating. When you're self-medicating, minimum of 2 days to 5 days, and you're still having the same persistent symptoms, please go and see your family doctor, see your physician for more tests. And when you go to see your physician, there's one thing I'm going to tell my African brothers and sisters. If you have a symptom that you have been medicating for 1 week and it still persists, go and see a doctor. See your family doctor. That is one. Don't go and see a pharmacist. There are difference between a pharmacist and a doctor. See a doctor and complain the symptoms that have been lingering for over a week, and let your doctor know the medication you've taken that is not helping. That is one. Secondly, when you see a doctor, no doctor should write you any prescription without running a blood test on you. That's one thing in Africa that I see that is everywhere. You go to see a doctor or go to hospital, they don't run you any test. They don't do any physical test, lab test, blood work. They just write you a medication to go and start medicating yourself. It is more than that. They give you a medication, you go and buy the medication and you are drinking. It might disappear for 1 month, 2 months, 3 months, 6 months and come back after 1 year again. The more you allow the illness to linger in your body, the more damages it's causing. The earlier you caught you caught that disease, the condition, the better you stand a chance of curing that disease. But once you allow that symptom to persist and allowing the doctor to write you a prescription without even running a blood work on you, that is not an effective treatment. Stay away from such doctors. When you go to a doctor, complain your symptoms, let him or her know the medication you've taken prior to coming to him. And then before any prescription, let him run a blood work. Send you to a blood work, urine test to know. From the result they got from their blood work, he or she will be able to know how to treat it. In Western world, let me tell you in Western world, how it is done. If you go to any doctor in Western world, developed world, no doctor is going to write a prescription with you without running a blood work on you. No doctor. You cannot walk into any doctor's office and say, I'm having this, I'm having that, and straightly he sit there and start writing medication for you. No. First of all, he will run a blood work, urine test, series of tests on you. When the tests come back, that test will guide that doctor on what is the situation, what is the condition, and know how to treat you. That is one. And once the test comes back and he sees something that requires a specialist, that doctor will refer you to a specialist for further investigation. That the blood work they did is inconclusive. Then they will refer you to a specialist. The specialist will now do their own work. And then once the result comes out, they will refer you back to your family doctor to continue your treatment. Now the doctor, the first test that is inconclusive, that requires a specialist attention, he will refer to a specialist. Now once the result of the specialist comes back, if it's something that the specialist can handle by himself, he will give you a prescription from there and treat it from there. But most times the specialist will now send back the result to your family doctor, and as you go back to your family doctor now, and then the family doctor will have the specialist result, the initial result, and fashion out how to treat you, and then they can now write a prescription. Excuse me. Because the specialist will advise your family doctor on way forward to treat this condition. Because every doctor wants to cover their own end. No doctor in Western world, you go to the doctor's office and complain a symptom or a disease or a condition and straight away start writing prescription. No. You must do the writing, run a test, and if that test is not conclusive that requires a specialist attention, your family doctor will refer you to a specialist. And a specialist will deal with that area of specialization to dig in and find out why you are having this condition, or what is the symptom, why is this symptom still persisting. And if that specialist finds out something that is outside his range, he will refer you to another specialist until they deep down into what is the cause of these symptoms. And once it is known, they will now refer you to your family doctor to continue from their investigation, that this is the situation, and this. Then the doctor sees the test and know how to write a prescription for you. So self-medication in Africa sometimes is something that we cause to ourselves that lead us to our death. If you have symptoms that last more than 5 days and you are self-medicating, please stop that self-medication and see your family doctor, and let your family doctor now take it from there to investigate more while you are still having these symptoms. So the 3 symptoms for high blood pressure that is more important is headache. When you continue having headache, you have headache today, you take a medication, painkiller, and it lasted for more than a week, then it's no more a headache. It's more than a headache. That's when you have to see a doctor. Dizziness is another symptom. That's number 2 symptoms of high blood pressure, dizziness. When you're having dizziness, that's another symptoms. 3, blood vision. Blood vision, dizziness, and headache are the symptoms of high blood pressure. Okay? So these are the 3 most important symptoms that once you notice these symptoms and it doesn't go away for 5 days, please see your family doctor to investigate more. Stop self-medication because you are causing more harm than good. Okay? The symptoms of high blood pressure may resemble other medical conditions or problems. Yes. Always consult your doctor for diagnosis. Like the blood vision, you can find it in diabetics. When you have a high blood pressure, high sugar level in your system, you have a blood vision, dizziness also. So every symptoms differs, or they may be similar. So once you have these symptoms as a high blood pressure, please see your family doctor to take over. Now, how do we prevent high blood pressures? High blood pressure can be prevented. Okay? How do you prevent it? 1, reduce your salt intake. I see in Africa, when we are eating food, we see somebody pour a lot of salt in their food. They are not telling you to stop salt into your food. They say reduce it. Not every time you are going to eat food, you are adding more salt to your food. No, you are causing more harm than good. So how do we reduce or prevent? How do we prevent high blood pressure? 1, reduce your salt intake. 2, engage in stress relieving activities. You have to engage in physical activities, exercising. Okay? Engage in stress relieving activities. That is 1, stress relieving activities. That is, don't do something that will stress you up. Okay? Do something that's gonna stress you less. That is number 2. Anything that's gonna stress you more, avoid it. Number 3, exercise regularly. Engage in exercising. Number 3, exercise regularly. Number 4, get to and stay at a healthy weight. Obesity. If you're obese, try to reduce your weight. You have to have a healthy weight. So if you're obese or you have a protruding stomach, okay, try to go enter a gym and reduce your weight. It is very important. Avoid excessive alcohol intake. Africa, avoid excessive alcohol intake. Number 6, stop smoking and avoid exposure to secondhand smoke. Stop smoking, avoid secondhand smoke. So that means if you're a smoker, stop smoking, and if you're not a smoker, avoid secondhand smoke. So if you're not a smoker, don't be around area people that smoke, or don't go in an enclosed area like a club, a party where there are smokers, because you are not exposing yourself to secondhand smoke, because there's no air share coming in, everything is enclosed. So whatever smoke that is being emitted out there, you are inhaling it. So if you're a smoker, stop smoking, and if you're not a smoker, don't expose yourself to secondhand smoke. All right? And then monitor your blood pressure regularly. Monitor your blood pressure regularly. Okay? Now, treatment of high blood pressure is medication. You can be on a medication for the rest of your life if you cannot manage it naturally, like exercising, so specific treatment for high blood pressure will be determined by your doctor based on your age, overall health, and medical history. So your doctor is in the best position to advise you on how to treat your high blood pressure. So each treatment depends on your age, overall health, and medical histories. These are the things your doctor will look at and say, okay, this is the best way to treat your high blood pressures. Extent of the disease. So if your high blood pressure was caught in time, that is an angle or another area your doctor will look at and know what is the extent of your high blood pressure and know how to treat it. Your tolerance for specific medications, procedures, or therapies. Okay, so you could be on a medication for the rest of your life. So everything depends on your doctor. They are in the best position. They are in the best position to fashion out a way to handle your high blood pressures. Expectation for the cause of the disease. Find out what is the cause of your high blood pressure, and then your opinion or preferences on the way forward to treat you. So it's like you are engaging with your family doctor to fashion out a way to treat you of your high blood pressure. Most of the time you are put on a pill for the rest of your life, 1 pill a day, to control your high blood pressure. Everything depends on your age, your health condition, and then your health histories, if you have any other conditions attached to it. So, and it may also include your exercising, balancing your diet, quit smoking, as well as medication prescribed by your doctor. So these are the things that the doctors have to look at and see which is best for you in handling your high blood pressure. Dieting, quitting smoking, avoid exposure to secondhand smokes, exercising, prescription by your doctor might be a last resort. It's okay, I've looked at your situation. I think the best thing is to put you on a pill once a day for the rest of your life. So friends, these are understanding diabetics with high blood pressure. The risks involved, knowing the risks, knowing the complications, how they are interwoven, and why it is important, why managing your diabetics. Look at your high blood pressure and your cholesterol. And if you have a condition of high blood pressure, you are not twice at risk of being struck by diabetics. Now, if you have diabetics and high blood pressure, you are now 4 times at risk to strike by high disease, which is your cholesterol. So your doctors are going to look at these 3 parameters and see which is the best way to handle your situation. So always consult your family doctors at all times, your dietitians, follow their instructions. Mine is an advocate to lay down the law in a layman's term, that you understand the complications of having both conditions at the same time. Alright, thank you for watching my video, and please do not forget to subscribe and share my video. Leave me a comment at the comment sections and I will respond. If you have any question, please do not forget to ask questions and I will respond back as soon as I can. Thank you, and I appreciate you guys watching my videos and your contributions. Thanks once again for following me. See you guys next time in my next video. Ciao.